Okay, my YouTube family, don't forget to subscribe with all notifications turned on. You know what we do here. I have this lovely customer that I'm bringing her to work. She works as a nurse, right?
Yes, sir.
Okay. So she works very long hours at the nursing hospital. And what today's Friday, so it's probably going to be very busy. And she says that she has the hardest time with people that have substance abuse. But you want to elaborate on that?
Yeah, yeah, because like I didn't come in here. So I started in Philippines. Then they hire us here. So each country has its different problems in healthcare system. So when I came in here in Florida, we noticed that there's like a lot of patients that are substance dependent, substance abuse dependent. So it's a kind of also a cultural shock for us. Then
Because
we
there's no
realized
drugs in the Philippines, right?
um, there is, but it's not what do you call this one? It's really taboo for us. So we
It's
don't.
taboo for
w-
the whole
Yeah,
country.
it's a taboo for the whole country. So we don't address it in the hospital. We don't. Um,
You don't see it too much in the hospitals
yes, and if they are, they would not tell us, and we're not treating it.
because the government is very strict when it comes to the drugs, correct?
Yes, yes. And back then, because I'm here already 10 years in America, so back then, there, if you are on the floor, the only highest medication that you can, pain medication you can give to the patient is morphine IV. That is the highest one. We don't have even Dilaudid, and we don't have even Percocet or other oxycodone or other
But isn't the
opioids.
morphine the highest tranquilizer?
So that's on our country. Here, it's there's like Dilaudid, then combination with the so IV and Dilaudid. Then there's Percocet, oxycodone, and there's a lot of
So
stuff.
all those medication are to treat pain,
Yeah,
correct?
to treat pain. But this
Correct.
is readily available here in
Here in
America.
America. So
And
when somebody's hurt or something, the hospital gives them a pain medication.
yeah, it's
In the old days, it was always kind of like morphine.
milder pain medication, and if it is like an opioid, the highest will be morphine. I don't know. Yeah, they did probably before also here in America.
And they will treat them even if they know that it's a very addictive drug, correct?
So I don't know. I think it's more of like a healthcare system conjunction with the pharmaceutical, because when I was also having a back pain, I just went to urgent care, and they're saying, "Oh, do you want Percocet?" I said, no," but they prescribed it to me. I did not take it. Just like Salompas and Tylenol and sleep and back brace.
Why you think they will offer Percocet just like that?
So the
In your opinion?
So the defense mechanism is just the research. Some of the pain medications are liver toxic, kidney toxic, and there are some stuff. So it's more like modernized that the pharmaceutical company develop a pain medication that is stronger for pain relief. So the purpose of it, it's supposed to be really good with the people, you know. But in the Duran, because like the if it is easily available in the urgent care, and if you are in prolonged stay in the hospital, so if you are used to that pain medication, you have resistance. Um, that you started even like a morphine, it's a habit forming resistance. You started with a low dose, then after a while with the same chronic pain, and it is not addressed,
But morphine, mo-
higher dose, then to the point that certain medication morphine is not working anymore. So Dilaudid is a synthetic morphine, so it's more potent because it's more in the chemical. So they would higher up it with Dilaudid. Then if it is doesn't work again, they would mix up it with other medication just to relieve the pain. It is initially it is really good for the patient to be like pain free, but sometimes too it really depends on the person, you
The
know.
person's
Yeah,
tolerant, the person's tolerance to the drug and also to the
to the
pain.
pain, yeah, if
Right,
it is.
right.
So when they are discharged, they cannot have IVs.
Correct.
So and they will be prescribed with the tablet,
Right.
with the but
Let me ask you a question.
mhm.
Do you think it's okay to have our medication come from China, for example?
So personally speaking, it's because I came from the Philippines, it's my neighboring country from China. There are some um what do you call this one, because our healthcare system also, our DOH have asked the China
Do you
to teach us.
in the Philippines do they make medication there too?
Yes, herbal medications, we are pro for that because most of the medication came from
Herbals,
plants. Yes, from
exactly.
herbal.
All these
Yes.
medication they
Mm-hmm.
take it an extract from the herbal, the natural stuff. Correct?
Yes. And also even here pharmacists study herbal medication from China. So they are selecting because there are multiple herbal medications that are being taught from all over the world. So there are some that really like from study and research that really gives a good what do you call this one, good effect, a good reputation that it really really works.
Right.
So I do hopefully think like um it's safe to say that hopefully pharmaceutical and other company would much more invest with that compared
Correct.
to just like to support their product and makes much more money and
They
hoping
mix our healthcare system is mixing everything
with business.
with
Mm,
business and politics and what do you
yeah,
think
I don't want to touch but
what do you think about universal health care? Do you think that giving free health care or affordable health care to the population would be beneficial instead of having, let me rephrase this. Do you think that offering universal health care in the long run would help our population instead of having a lot of mentally ill people just walking around the streets?
okay, so there's a what do you call this one, I would say that the universal healthcare as what we have like there are some policy that is like really the intention is really good, but if the people and some greedy people and some people who knows this the system would abuse it, it would break the system and it would make it turns into bad. So one of my sister is working in UK. I think they are universal healthcare system, so it's good because it's readily available for all people.
And Canada too.
Yeah.
If you think about, how about Philippines?
So for
They have universal
we,
health care there?
no, we pay on our own pocket. That's what I have when I get out there. So I've been not in the Philippines for 10 years already. I think they're following now the pattern of America that it is like healthcare insurance, but it's different too because when we pay on our own pocket.
There's a problem, two problems we have in America.
Mm-hmm.
It's the healthcare system, but also the insurance problem. It's
Yeah.
like there's a battle. I picked up this lady
Mm-hmm.
yesterday just for some hearing aids,
Mm-hmm.
and it was $15.99, $1,600 for two hearing aids. Her balance at the end was zero. She showed me the bill.
Mm-hmm.
She didn't pay nothing
Mm-hmm.
because
That's it. Well,
she is in the low type of bracket. You know, she gets welfare, food stamps, and everything. You know what I mean? So knowing that these hearing aids do not cost that much,
Yeah.
how can it go through the system without raising any red flags?
Yeah. So I don't because like I've been working. So this is my own uh like um like the world have in my eyes, my perspective. So the healthcare, the what is this? The insurance, it is good when because it's supposed to be helping people to pay for medical needs and stuff like that. But
Preventive
yeah,
preventive healthcare is what we actually need in this country to
mhm,
prevent.
yeah.
Now,
No, the insurance is the payments. Like they would help aid you for the payment. So it is good that it is helping, but there are things too that right now, some of the health insurance are like, oh, we don't do this, we don't do this, we don't do this. So sometimes personally for me, I work in the healthcare system, but because like you're getting old, you have to take care of yourself. You have some procedures like heart procedures or stuff like that. So the insurance covers it, but sometimes most of the time you have to pay it out of the pocket. Like
right,
I was working, and then I was taking this niacin. I did not know that it was a reaction. I was beet red, so I went to the ER. So they went to the ER. They just prescribed me with Benadryl PO, and just like they take my blood. They gave me a IV fluids, Benadryl PO, send me home. So I said, okay, I think that, and they said like, oh, it's covered by the insurance. Then a long one, they would tell you, oh, you have a bill, it's like a 900 for for a doctor's fee. I said I didn't even talk to the
right.
doctor. It was just like my fellow nurse.
Or for example,
Yeah, and I'm working,
yep.
and I have a good share for that insurance. So you think
There's abuse, and
that
nobody checks anything.
so it doesn't. So I have some elderly people. They're crying because for transferring, and they serve the country for a long time too. So, because of their healthcare, the healthcare insurance that they have cannot pay for this
Procedure,
facility that they could be taken care of properly,
right?
like a memory unit, and no one is um, um, there's no voice for them because they're demented
Let
and
me
stuff
ask you a
like that.
question to finish
Yeah.
this quickly. So our healthcare system
Mm-hmm.
needs a very big reform. Do you think so or no?
Yes, it needs to be reviewed and stuff like that. Like there are advantage, but just check the loopholes if it does.
Nobody's checking anything, right?
Yeah, if it does really help the people sick,
Yeah.
really really sick, and the people like in the middle class family, in the middle class system, and the elderly.
Yes.
I think the elderly has is really really been um forgotten.
Neglected. God bless America. Please drive safe. Have a wonderful time at work. Hopefully, it won't be too crazy.
Thank you so
And
much.
don't forget to subscribe with all notifications turned on. God
Thank
bless.
you. God bless.